do for hip flexion. So we're going to bring them up to this position here. Okay, I want you to hold there for me. I'm going to use my hand here to palpate proximally, just because I want him to know where this other hand is, right? You don't have to have it here, but this is just where I tend to palpate so I know that the muscle's working. So what I want you to do is hold, don't let me move you. Okay, so I'm trying to push him into more extension, so I'm working the hip flexors. I'm holding a couple of seconds and then relaxing off of it. So I'm gradually building my pressure, okay? Then I'm gonna have you stay here. Now I'm looking at hip extensor strength, so glute max and hamstrings, the knee is bent. You're gonna press out, hold, don't let me move you. It's all about mechanical advantage. Okay, so then I'm gonna have you hold your feet just like this, toes up toward the ceiling, okay? And I want you to just hold here, don't let me move you. Tight. Okay, so I'm trying to press him out into abduction. I'm testing his adductors. Bring you in a little bit. Hold, don't let me move you. Okay, now I'm testing his abductors. Good. So what I'm doing is just a gross bilateral comparison. If I were to feel a weakness in any of those, then I'm going to go back to the foundation sway, okay, and give him a muscle grade. If it feels good and symmetrical throughout, I can just say within normal limits or 5 out of 5 throughout, okay? While we're in this position, you can test the hip rotators. I just want you guys to make sure that you're supporting the knee so you're not changing the angle of the abduction or adduction of the hip, okay? And I think it's a little bit harder to control this way, so I'm also going to show you prone. But you're going to hold there, don't let me move you. Good. Bring me out, hold there, don't let me move you. Good, okay? So that's how we can test internal, external rotation, and then I'm going to have you flip over on your stomach. Now, if I do it supine, I have to do it one at a time, and it's a little hard to judge when you're first starting out if the strength is equal. Scoot back a little bit more toward me. Good. Even more. Keep coming. Way down. Okay. All right, I'm going to bend your knees. Good. So now I can test them bilaterally at the same time. I'm in a good stride length stance, so I'm not bending. And I had him come closer to me, so I'm not having to reach really far. And actually scoot a little bit more toward me. It's about me right now. Hold there, don't let me move you. Good. Okay, now we're going to bring you in. Hold there, don't let me move you. Okay, and he's good and strong, both. Now, the only thing I would cue you to do is when the patient is prone, you can't see their face or grimacing. So you want to communicate with the patient, please tell me if this is painful or reproduces your symptoms. Okay? All right, let's practice this.